you've got somewhat of an easier sell in the United States, in the way that you've got insurance companies, you've got people who've got to pay. It's a lot tougher in the UK from a preventative perspective. Right. You know, we've got a national health service here. People don't pay at point of service, so it's going to be their first port of call in almost every instance because it's simple. It doesn't cost them anything. You know, and universal healthcare is a good thing overall.
But I wish we had it.
Right.
And you guys got the right idea.
Right. What can intelligent eating be doing to model what you've been doing in the States over? I mean, you and the Esselstons and so on. What could we take from that? Do you think, in terms of getting that message to people at a preventative level? That's what's so important, rather than getting people around 11 where they're really up against the ropes.
Absolutely. Well, far be it from me for this ignorant yank to come and tell you distinguished bits how to run your medical system. But one of the major forces that's forcing the American medical system to look at nutrition is the money involved in ignoring it. We're paying these spectacular amounts of money for these expensive therapies, the coronary artery bypasses. It costs $250,000 that the insurance companies have to pay out. And for what? The man has this procedure and he goes through this hellacious recovery and for 3 weeks limps out of the hospital for what? To go out and eat more cheeseburgers and pizzas and clog up their grafts because nobody's taught them about what the main problem is. And again, that's just a bankrupt, literally, kind of medicine because it will bankrupt our system. I was talking to the head of the plant-based insurance actuaries. I didn't even know there was such a thing. But they said, Doc, we see the vegans, we pay out a lot less money for the vegans than we do everyone else. And he says the numbers really suggest a solution. By the time we pay for 4-vessel bypass, I mentioned, we pay $250,000 to the surgeon, the anesthesia, the recovery room, etc. Well, if in say a 10-year period, that man does not have a heart attack, or doesn't need a bypass, we're sitting on that $10,000, that $250,000. We'll happily give $10,000 to the doctor for keeping his patient healthy. We'll give $10,000 to the patient for staying healthy, $10,000 to the clinic. We're still sitting on $200,000 profit. There's profit in keeping people healthy. There's value to the community. For every CEO that doesn't go down with a heart attack, that's worth something. For every young breadwinner that doesn't develop a colon cancer, that's worth something. And the money is in the system. We need to, the bean counters need to change how the beans are flowing to reward the people for staying healthy. It's called value-based compensation because there's value to the community. And that's what really needs to happen. And a simple ironclad case can be made that prevention is a lot cheaper than treatment. And plant-based nutrition is by far the best form of prevention. So it's a matter of the insurance folks and the actuaries and the financial folks sitting down and just doing the hardest nails calculations, and they'll see they should be paying for dietitians to do plant-based nutrition counseling. Because as you mentioned, the doctors say, one, I don't know anything about nutrition, I don't have time to do this on my busy schedule, and I don't get paid for it. And that's for the plant-based dietitians. I love that because they take away the doctor's excuses. Doctor, you don't have to know how to do counseling. Just understand that that person sitting in front of you, obese and hypertensive and diabetic and inflamed, is there because of what they're eating. And if you get them on a plant-based diet, these diseases go away. You need to know that. So send the patient to a dietitian, let her do the counseling, let her show them the videos, let her take them shopping, let her talk about what to really eat, and then see them back in a month. And if they're not leaner and healthier, then talk to the dietitian what's going on. But incorporate her into your treatment team, and it takes the burden off you, it gets the patient healthy, and it saves the system money. So that's the missing piece that really needs to be inserted into the system.